The sciatic nerve is the largest nerve in the body, and it's made up of multiple nerve roots that come off of the low back. So it's made up of L4, L5, S1, S2, and S3. These all come out, and then they form this thick nerve that travels down behind your butt and then all the way down your leg, and then it branches off into other nerves that are continuous with it down in the lower leg that can go to the back of the leg, the front of the leg, the top of the foot, and the bottom of the foot, which is why there's so many different presentations for people that are struggling with sciatica. So a lot of the times what the recommendation is for people that are dealing with sciatica is to stretch the piriformis. And the reason why is because the sciatic nerve travels behind the piriformis. So if the piriformis is really tight and it's compressing that nerve, it can actually create some issues with that nerve. Another thing that can happen, which is very, very rare, is that sciatic nerve can actually go through the piriformis muscle. So when you're developing, there are certain cases where the sciatic nerve is actually surrounded by and goes through the actual belly of the piriformis, but that's not very common what we're going to be seeing. What I find is the most common thing is that there's some level of compression of the nerve roots in the low back, whether it be between L4, L5 or L5 and the sacrum, that irritate the nerve, and then that can create pain that's referred down the leg. The interesting thing about sciatica, though, is sometimes when somebody has a compressed nerve root, they can feel pain immediately right there in the low back, and they can trace it all the way down the leg. Other times, people feel nothing in the low back, but they might feel it in their hamstring, or they might feel it in their calf, or even just in their foot. I can't tell you how many patients I've had that come in with lower leg or foot issues, and the root cause of the issue can be traced to their low back, which is why we really need a systematic approach and a very thorough evaluation to determine exactly what's causing it. Because a lot of the times, the things that you're feeling are the effect rather than the cause. The tight piriformis, the tight hamstring, the pain radiating down the leg, the tightness in the foot, the numbness, all of those things are just effects, but there is usually a cause to the problem. So we want to start at the spine, figure out, make sure that that is healthy, that there's no issues there, and then move distally from there down that whole kinetic chain to find out exactly what needs to be done for you to recover and get back to functioning at your best.